everyone, I'm Dr. Krithika Rajaraman, Developmental Pediatrician in Motherhood Hospitals, Bhopal. Child development and issues regarding it. Speech delay is a very common concern in child development, and post-COVID, it has become quite common. Now, if a child with delay in speech come to us, what is that we are going to say is we are going to not look only into speech, we will look into multiple developmental domains. Is a child's motor functioning is fine or not? Gross motor functioning, fine motor functioning. When I say gross motor, fine motor, it is basically, is a child able to walk? Is a child able to climb stairs? Appropriate for age is a child's motor milestones are good, and is a child's fine motor is basically hand functions are good. So if a child is coming for a speech delay, why are we looking at other development? Because all the development of a child go in cohesion. It's not that in one area the child develops, other area child doesn't develop. So we look into motor development. Then we are not concerned only about speech output. We look into how much the child understands, whether when we say some simple instructions or instructions slightly complex for older age children, is a child able to follow those instructions. The next one, we look into how is a child's social development. For a smaller child below 18 months of age, we look into is a child's joint attention is good. What do I mean by joint attention? Can the child respond to his name? When I call his name, is it easy for me to get his attention? Second is, when I am trying to show the child, point and show to something, is a child able to follow that or not? So that me and the child are looking at the object together. That is, we are sharing attention together. Third thing, what I would look at is a child trying to share his world to me by pointing out at something? If it is not to me, it is to his parents. Does he or she points and share his attention to his parents? Does he bring and show the toys to the parents so that the child is enjoying the social interaction? And how is the child's imitation skills? If the parent is trying to do something, is a child immediately tries to copy it. If all these development are good, then the child's joint attention is good. That means a child's social development by 18 months of age is going in the right track. Along with that, we try to see like how is a child trying to play with other children, be with sharing the space with other children, trying to interact with them. How is a child's play skills, pretend play skills? All these areas are considered, and along with these delays, if there's going to be delay in these areas, along with that, if there's going to be an expressive language delay also, then it is a major concern. If all other development is in place, the child is appropriate for his or her age, but it's only an expressive language delay, then the possible reason could be COVID. During COVID, they didn't have enough social interaction. It is like all the time the child was inside the house with only parents, and parents are doing their online work. Might be the child didn't have enough stimulation, and too much of screen time can also cause expressive language delay. If the child gets an opportunity to be with other kids in a play school, this should automatically improve. If in other areas of development, if the child has problem, then it is not that we jump in and say like the child has problem. We need to do a detailed assessment. It is done by a team of professionals, speech therapist, psychologist, occupational therapist, and then we decide whether the child needs therapy or not. My child being hyperactive, is it a concern or not? Now, to define hyperactivity, it is not just a behavior of the child. What is a social situation or what is a context? In that particular context, is a child's behavior appropriate or not? If we look in a playground, all children are going to run around. It's going to be haphazard. It's going to be chaotic. We are not going to call that as hyperactivity. But in a school situation or in a classroom setting, how is a child going to conduct himself? That is important. Now, post-COVID, 2 years, most of the children were in online schooling, or the kindergarten, the children who is entering into kindergarten didn't have the playgroup experience at all. The child who is entering into primary schooling didn't have kindergarten experience at all. So all these also matter when we consider the child's behavior is hyperactive or not. So if hyperactivity is a concern, then there would be a screening questionnaire which is done with the parents. Is it in one setting only the child is hyperactive? Because at home alone the child is really hyperactive, but in school setting or in other outside setting, community setting, if the child is not hyperactive, then it is boredom. The child doesn't know to engage himself. So because of boredom, the child is being naughty. But in multiple setting, in home and at school, if the child is hyperactive, then we are going to look into other areas of development. How is a child's language development? Is a child able to express himself according to his or her age? Second thing is, how is a child's social development? In a social situation, is a child is able to understand how he has to relate to others. If the child is not relating to others, obviously the behavior might look like hyperactivity. Third is, how is the attention of the child? Fourth is, we look into how is a child's cognition, academic concepts or any concepts based understanding, how is a child able to grasp. For example, if a child has a learning issue, it might be a specific learning disability only with regard to academics if the child has a problem, or overall the child cognition itself is low, then we feel like the child is not interested in learning, so the child tends to move around in the class. So that might also be manifested as hyperactivity. So if a child comes with hyperactivity, there is a parental questionnaire which the parents need to fill, and the teachers, whoever the other outside environment where the child is spending little bit of more time than his home, there also we would try to get the form filled by the teacher, and we try to combine these two forms and see like really is it an hyperactivity. Then we go ahead with assessments to check the cognition of the child, to check the language skills of the child, to check the executive function. So what do I mean by executive function is, for a third grader, if the teacher says a multi-step instruction, open your bag, take your English book and turn and open the page number 71. These multi-step instruction, a third grader is expected to do. Now, for the first few months, the teachers are understanding that, okay, it's because the child is exposed after 2 years of online schooling, they have been accommodating children. But after that also, if the child has not learnt it, the child feels distracted in the classroom, then we look into how is the executive function of the child. Executive function is time management, organizing skills, self-regulation of their emotion and sustained focus. All these comes under executive function. So we also look into the executive functioning of the child, and based on that we decide whether the child has ADHD or it's just an hyperactivity. It might be boredom, it might be a language delay, it might be a social delay which is causing hyperactivity as a symptom, but it's not ADHD. Learning issues in children post-COVID is quite common. It's been very common. As doctors, we are also not sure whether it is really the child is having an issue in learning or 2 years of online schooling which has caused this difference in the learning. Now it's been almost 1 year that the children are attending the regular schooling. If a child is not still able to cope with the schooling, then obviously it's a concern from the teachers also, and it's concern from the parents also. Is a child really having a learning issue or not? If a child has a learning issue, then we look into overall development of the child. In the early development, did the child had any motor delays? Like the child had any delay in his walking? Did the child had any delay in picking up language? Did the child had any delay in his social interaction? So the early history is very important, and along with that, we try to look into how is the conceptual understanding of the child. Whether the delay is only with regard to academics. For example, the child has a problem in remembering the order of a number, order of an alphabet, or if he has to say the weekdays, if he has to remember the order and say the days of the week, in that the child has a problem. Or if there's going to be confusion in the letters, B and D, there is a confusion, M and N, there is a confusion, Z and N, there is a confusion. Or the child writes the letters in a reversed way. B, the child starts missing every B and put it as D. If there's going to be confusion in this, before, after, there is a confusion in mathematics. If the child shows these signs, and if the child is being trained for 1 year and still these concerns exist, then we call it as risk for learning disorder. But however, if the child's intelligence seems to be fine, for example, parents says like my son is very shrewd or my daughter is very shrewd, with regard to life skills like their self-help skills, they are very good, independent. If the child has to go to a nearby house and get something and come, or nearby shop and get something and come, the child is very good. But only when it comes to academics, the child is having a problem, then it can be specific learning disability. During COVID, yes, most of the children were not given adequate opportunities or they didn't practice spellings. It was all MCQ type of test. So after that period of 2 years, when they were shifted to the online actual schooling, most children had some issues or the other. But over time, if these issues have not settled, but it's going to be persisting, then there is a good chance that the child has specific learning disability. So what do we do after an initial screening? We go ahead with assessments. How is the child's intelligence with regard to his standard? For example, if the child is in 3rd standard, can the child do the mathematics, comprehension, reading and spelling of the 3rd grade? We would try to check. If the child is not able to do the 3rd grade, then we check with 2nd grade, 1st grade. That we call it as curriculum-based assessment. At what standard level the child is able to comfortably do. If the difference between that is more than 2 standard deviation, for example, the child is in 3rd standard but functioning like a 1st standard or below 1st standard, then the child has a learning disability, for which if we start early intervention, then it is going to be beneficial to the child. Behavioral issues in children, yeah, there are certain things where the child might have deficit, or it could be from the environment, or it could be a part of parenting. So if a child is throwing a tantrum, what we look into is, for any behavior to happen, what did happen prior to it? What is the antecedent? Antecedent is what happened? I didn't get a chocolate, or I asked for something, my mother didn't give me. That could be an antecedent. What is a behavior? It could be a big tantrum, meltdown, throwing things, hitting mother. That is the behavior. What is the consequences? After the child does all the tantrum, if the child is going to get that biscuit, then the child starts feeling, okay, I have to ask for one time. The second time, I should cry. If I'm still not getting, I should start throwing a tantrum, hitting others, falling down and crying, then I'm going to get a biscuit. So who is strengthening this behavior is the environment, which is strengthening it. So when a child has a behavior, first we look into, is a child has any developmental related issue. The child is not able to cope up with his language development. If the child is not coping up with his social development, then behaviors can happen. Otherwise, the behavior is being sustained by the consequences which is being provided by the teachers, parents or the caretakers. So we look into a detailed behavioral history, why it is happening, and sometimes it could be external triggers. The child is sick, the child is tired, the child is sleepy. So that might also cause behaviors. So is a child's sleep is absolutely fine. Is a child is having any gut issues, constipation, if the child is having any reflex issues, that can also irritate the child and the child can have behaviors. So if a child is coming to us with behavior, we look into the development, we look into any trigger factors, associated biological factors, is it present or is it an environmental factors, and then we look if any assessment is needed or a counseling is needed. That's what we are going to look into. Summing up, when it comes to any developmental delays, if you are concerned about your child's development, don't wait and watch. Come meet your pediatrician or developmental pediatrician. We are going to do an overall assessment of your child. It's going to be screening. If in screening the child's development looks fine, it's going to be counseling to you, and what are the facilitation which you can do at home would be suggested. If we feel that there's going to be a problem, then further assessment would be done. So rather than wait and watch, if you come for assessments and therapy, early intervention is going to help your child to move forward in life. will help your child to reach his or her potential fully. So I would recommend all of you to track your child's development. If there's going to be any delay, please discuss with your pediatrician or your developmental pediatrician. Thank you.